We are on so many new platforms. So you're probably watching us on YouTube or on Christ Centered TV. If so, hello. And please follow us on all of our socials, that is TikTok, Instagram, and Facebook, as well as YouTube. So I want to thank you for tuning in today. And I want to ask you to go ahead and grab you something to sip on because we're going to dive right into these topics. And this season of Butterfly Chats is going to be full of education, laughs, information, and edification. And I definitely hope and pray that you are filled with hope that no matter what situation you're in currently, that you will be able to find your way out of it. So let's get to it. So I am Latoya, your host, and I want to welcome you to Butterfly Chats. This podcast is dedicated to the chronically ill and their caregivers. I want to welcome you into this guide, and we're going to guide you through our stories, our insights, and through discussions that will inspire you, educate, and empower you on your chronic pain journey. But before we get started, I do want to share a disclaimer. Please, please note that I am a current warrior with chronic pain due to fibromyalgia and other chronic comorbidities. I am not a licensed medical professional. The information shared in this podcast is for informational purposes only and should not be considered medical advice. I am not advising you to change any current or future medical treatments plans you may be on. It is critical that you consult your own medical teams before trying or making any changes to your current or future medical plans. All right. So now that we got yeah. Now that we got all that out of the way, let's get into these topics. Today is going to be just me paving the way for all of these amazing interviews that we have coming up. I have J.R. Reynolds from Eagle Vision Productions. I have Sharmila Chrisman, a wonderful advocate for lipedema advocacy. A wonderful conversation we had. It's going to be so many laughs and it's going to be so much information. Just so much information for people of color, women of color, and so much so much empowerment that we have to find on our own because there's no other way to get it, unfortunately. That as it stands right now, the medical community has always and still currently leaves us out to dry. So we have to help ourselves. And that's what we are here for. That is what Butterfly Chats is here for. Is to help you to help yourself. So we want to help you by doing the heavy lifting. Today's episode is going to be about vulnerability and how vulnerable being chronically ill is. Um, and how vulnerable you have to be and allow yourself to be in order to quote unquote be a good patient. Um, before we do that, or before I do that, for any of you and many of you who have never seen me before, and for many of you who do not know my story, I'm going to give you a quick synopsis of how I became introduced with chronic illness and where my experience lies when it comes to chronic pain and where I get my education from in this area. So I want to thank you for joining me today, and we're going to embark on this journey of vulnerability and resilience despite our chronic pain. And I'm going to share with you these stories. So, I was diagnosed with chronic pain in 2015 after doctors discovered massive fibroid tumors. On their own, fibroids are not that dangerous. Millions of Black women, especially, get fibroids every day, every year. If caught early, there's so many treatment plans that helps them to be able to be treated, and you go on about your day. N- More often than not, though, sometimes things get missed. In my case, they were significantly missed, and these fibroids were grossly misdiagnosed, undiagnosed, and by the time they found them, they were massive and overgrown and enlarged. It took around 3 to 4 surgeries to remove all of the tumors, and by then, um, they had left what doctors called collateral damage from the multiple surgeries to remove them. These surgeries took place in 2016 and left me with doctors called what they named bruised bladder, herniated L4, L5, and what I just recently learned was also my S1. As a result, this has been caused me to live with minimal mobility and significant weight gain. Basically, between the medications, all the treatments from treating the tumors before they actually really knew if they were all benign, which mine all ended up being benign, thank God. But they could not biopsy all of them. It's a whole story behind that. Um, and with so many years of limited mobility, weight gain happens. Um, Unfortunately, this intersection um, of my identity as a Black woman, coupled with my weight and chronic pain, also led to a bias based barriers. People often perceived me as lazy, unmotivated, which couldn't be further from the truth. Before my illness, I was a thriving pastry chef, pursuing my dream as a head pastry chef at Papa Do's Seafood Kitchen. I was living the dream. But yes, life to me to death. The onset of my fibromyalgia forced me to have to move home with my parents. Gag. And turned not only my life, also my family's life upside down. Navigating this diagnosis also was such a minefield because at that same time, my father was also diagnosed with his second round of cancer, which the second round was blood cancer. So, hmm. So the doctor's lack of current education and the absence of concrete treatment plans for fibromyalgia have left us with limited options for care. It's disheartening to encounter doctors who refuse to see us, assuming we're only seeking drugs, or those who prescribe antidepressants as mere band-aids for symptom management, dismissing the real struggles we face. Even if we were fortunate enough to find a doctor who believes in us, their prescribing options are severely limited due to the lack of reference guides and educational resources for fibromyalgia. The available treatments and therapies, such as physical therapy and repurposed drugs, are often poorly covered by insurance, if covered at all. This leaves us with a difficult choice of paying out of pocket or foregoing the treatment altogether, further adding to our medical difficulties and then our medical decline. And then, like we need any more challenges, here's another challenge we face as fibromyalgia patients is the lack of universal recognition of our condition as a disability. While it is categorized as a monoscapular monoscapular condition, the pain and dysfunction actually originates from our neurological system. We are working on some advocacy and some legislation to get that classification changed, but the uphill battle to get that done, man, we don't have time to talk about that. Proper research is needed to classify fibromyalgia, allowing us to access the support and resources we desperately need to relieve our symptoms and support our families. As it stands now, the current classification brings additional stress to both the patient and the system. Fibromyalgia claims constantly being denied. Often we must wait until our mobility and our quality of life has significantly deteriorated before we have limited options for care, risking the loss of our independence and our dignity. So, I'm sure many of you can relate to the devastating moment when we were first told that chronic pain would be our lifelong companion. I totally believe I literally blacked out because who wants to believe that they're going to be in pain for the rest of their life? Like the thought that you're not going to experience a pain free moment ever again is like, what? You know? It feels like our lives were suddenly upended and with double booked doctor's appointments and a never-ending stream of medical procedures. And let's not even start on the mountain of medical bills that seems to grow with each passing day. It's overwhelming to say the least. I mean, yeah. The moment we are informed that chronic pain will be our constant companion throughout our lives is devastating. It ha- it's as if the ground beneath us has shifted and the life we once knew is suddenly unrecognizable. The implications of this news is far reaching and the challenges that follow can be overwhelming in every aspect of our lives because we don't even think about it's it affects our families, our friends, our co-workers, our bosses. It it's like a vine that just goes out and it keeps going and going and going. But and like the further out that limb goes, it's like the more confined the patient becomes because you just kind of retreat inside yourself. Doctor's appointments become a regular part of our lives, sometimes even double booked, double booked to address the multiple layers of our conditions. We find ourselves navigating a complex medical system that was really never made for us to begin with. Searching for answers, relief, and effective medical treatments. The journey often includes countless medical procedures, tests, and consultations with specialists, all amid all aimed at managing our chronic pain and its related symptoms, not necessarily addressing the actual issue, the culprit. All the things that we are having to walk through are all band-aids, basically. And honestly, the medical system only has band-aids for us. That's the thing. They don't really know what fibromyalgia is. And instead of just saying that, they're just going to give you pills to address whatever it is you're complaining about. Um, and it doesn't really help. Um, so, amid the pursuit for relief, we are confronted with an ever growing mountain of medical bills. It seems that even every day, the financial strains gets worse. The cost of consultations, medications, therapies, and procedures, acupunctures, placing an immense burden on us and our loved ones. The weight of these expenses only add to the stress and challenges we already face in managing our conditions. Just getting up every day or not getting up every day. Just waking up to stay in the bed because you can only turn over. And that's the reality of chronic pain. Some days some days are bare minimum days. Um yeah. Not only do we grapple with the physical and emotional toll of chronic pain, but we also become entangled in a complex web of financial uncertainty. The constant worry about how to afford the necessary treatments and support can be an additional source of anxiety and frustration. It's because it becomes an delicate balancing act, juggling our health needs and the financial responsibilities we find ourselves in. Now, have you noticed that all of the things that I've been talking about so far have all been like outside stuff? Medical bills and doctor's appointments and this, that, and the other. Have we talked about the light bill, grocery bills? Have we talked about little Johnny's um soccer practice? Have we talked about gas bill? Have we talked about any of the life things that we also need money for? No, we haven't. But all of those things also have to take place. So when you have a chronic illness and then a family, you also have to keep in mind that then we also have to decide, okay, well, am I going to go to that specialist and pay that copay for them to maybe not be able to help me at all? Or am I gonna pay little Johnny's back to school fees? Or am I gonna pay little Susie's dance recital fees? Am I gonna go buy groceries this week? Am I gonna pay the light bill this week? Life is still happening. you know and one of the big things they tell us when they're trying to help us cope with chronic pain is don't stress, reduce your stress, stay calm, breathe, relax, release, meditate, go into your zen mode. Where they do that at? How they do that? So the overwhelming nature of chronic pain and its associated costs often leaves us feeling isolated and helpless. It's a battle that goes beyond the physical symptoms as we are thrust into the world of our medical needs and financial constraints. However, it's crucial to remember that we are not alone in this struggle. Together, we can seek support, share resources, and advocate for a healthcare system that addresses the challenges faced by those with chronic pain. By raising awareness and engaging in open conversations about the financial aspects of chronic pain, we can work together to be more compassionate and inclusive system. It is through our collective voices that we can shed light on the realities of living with chronic pain, including the financial burdens, and advocate for change. The lived experience of one with fibromyalgia often goes hand in hand with the challenges of chronic pain and the invisible nature of the condition. Fibromyalgia is categorized by widespread pain throughout the body, which can be debilitating and persistent. It oftentimes very much so is, not can be. It is. What makes fibromyalgia particularly devious is that it's invisible. The pain and the impact are very real. The most off this most often leads to misunderstandings, skepticism, and a lack of empathy from others who may struggle to comprehend the severity of the condition that never takes a day off. The invisibility of fibromyalgia adds an additional layer of vulnerability as individuals with the condition often have to battle not only the physical pain, but also the challenges of being unseen and unheard. This is why we're here. It's why we're here. It's essential to recognize and validate the experiences of individuals with fibromyalgia, acknowledging that our pain is valid even if it's not readily visible to others. Building awareness and understanding around the invisible nature of fibromyalgia can help break down barriers and foster a more compassionate and supportive environment for those living with the condition. By amplifying the voices of those affected by chronic pain and invisible pain, we can work towards creating a society that the recognizes and accommodates the unique needs of individuals with fibromyalgia. It is through empathy, education, and open dialogue that we can collectively promote greater awareness, compassion, and support for those navigating the complex intersections of fibromyalgia, chronic pain, and the invisibility that comes with it. The impact of fibromyalgia on one's life can leave them feeling incredibly vulnerable. And it's a condition that can be seemingly whisk away everything that one once knew and cherished. And even, and it often happens without any fault of their own. Very much so. The um, the exact cause of fibromyalgia remains uncertain, but many individuals closely tie it onset to some sort of trauma, be it emotional, mental, or physical. This is why being this is why continuing to keep the mental health matters, mental health awareness talk open and alive is so very, very, very important. The connection between fibromyalgia and trauma is the topic that resonates deeply within the chronic pain community. Many individuals with chronic pain and fibromyalgia report having experienced significant traumas in their lives, whether it is a traumatic event, chronic stress, or a series of physical injuries. This correlation is not coincidental, as the toll of trauma can manifest in various ways, including the development or exacerbation of fibromyalgia symptoms. The experience of living with fibromyalgia often goes hand in hand with some form of past post traumatic stress disorder. The chronic pain and the challenges associated with it can be emotionally and mentally overwhelming, leading to heightened anxiety, depression, and a constant state of hypervigilance. The pain itself can act as a constant reminder of the trauma, enduring, amplifying the emotional and psychological burden carried by the individual with fibromyalgia. It's it's like it's like the endless stepping on the nail. Like you're constantly stepping on a nail, and you're literally not allowed to forget the pain. It's crucial to recognize and to address the emotional and mental health aspects of fibromyalgia and chronic pain and invisible illness. They all go hand in hand. A lot of people use all three terms interchangeably because a lot of times they are interchangeable. Chronic pain, invisible pain, they're all the same, as they significantly impact the overall well-being of individuals affected by the condition. Seeking support from mental health professionals, engaging in therapy, and practicing self-care strategies are vital components of managing the holistic impact of fibromyalgia. By acknowledging the connection between trauma and fibromyalgia, we can foster greater understanding and compassion for those living with the condition. It's important to create safe spaces where individuals can openly discuss their experiences, share their stories, and find support from others who can relate to their journey. Through increased awareness and empathy, we can work towards desensitizing the emotional and mental health aspects of fibromyalgia and promoting comprehensive care for those affected by this complex condition. So, that is it. That is it in a nutshell. Um Basically, to sum this whole episode up in a couple of words, be kind, be nice, be fair. Um, Understanding that uh, a person with chronic illness is literally doing the best they can do. And um, when they are being short or when short tempered, snippy, snappy, whatever you want to call it, it's because they are at their wits. They're at the very end of all the ropes they have. Um, and all they really need is compassion. You know, asking us a whole bunch of questions when we're in the midst of a flare or in a pre-flare or just post-flare. It's not the time to ask us a whole bunch of questions. I'm so sorry. It's just not. um, Doing your own research that helps instead of having us do all the education and all the reading for you. If you are a caregiver and you really, really want to help, do some education of yourself. Look it up. Google is free for everybody. Um, yes, ask us to help you and work through some things together, but don't expect for us to always be there to hold your hand. Um, so yeah, just be kind and be understanding and be fair and to understand that we are literally doing the absolute best that we can. And trying to find a new purpose for our lives is way harder than one would think. So, yeah. Um that's it for this week. um I am super excited that you guys are here for this season and all the other seasons to come. And we will be navigating these challenges and to find the strength in our shared experiences. So, thank you for listening. And remember, you are not alone in this journey.